Welcome to our last news briefing of the week. This is the first one in the month of December. Mayor Demings will be discussing in depth Executive Order 2020-51, which he signed just a short time ago. He'll also go over our toy drive, a pet food giveaway, and CARES Act funding. Dr. Raul Pino is also here. He'll be talking about the coronavirus numbers and what we can do to slow the spread. Now, Mayor Demings.
Good afternoon. Thank you all for being here. 2 years ago today, I was sworn in as the Orange County Mayor. Since that period of time, an awful lot has happened in this community. But we have arrived at a critical juncture in our fight to contain the transmission of the novel coronavirus within our community. And I now find myself in a position that I must make an adjustment in our strategy. For weeks now, I have pleaded with our community to do the right thing to help us help you. We have asked for voluntary compliance and following the CDC guidelines during this public health crisis. Overall, we have seen most of our residents and visitors voluntarily complying, but unfortunately, we've had a few businesses that have refused to comply, and it is time that we hold them accountable. Today, I spoke with one of my team members who is currently in the hospital after testing positive for contracting the COVID-19 virus. She happens to be an Orange County fire inspector assigned to our compliance or strike teams. She told me that her teenage daughter also tested positive, but her daughter recovered without hospitalization. She asked me to tell everyone that COVID-19 is no joke. I also spoke to another one of my Orange County Corrections staff members who is in the hospital. She too has been in the hospital for about a week after testing positive for COVID-19. I could hear this correctional staff member laboring to breathe. And I was reminded once again that this pandemic is no joke. I now have family members who have also tested positive. 9 months ago, when I would ask any audience to raise their hands if they knew someone who tested positive, few hands would go up. So if I ask you in this audience today, how many of you know someone who's tested positive or who has died as a result of the novel coronavirus? Raise your hands. Okay. Clearly, the majority of you have raised your hands. So what that means is that today, things have changed. So when we give the cumulative numbers, they represent real human beings, and it saddens me to see the numbers continue to grow, because that means another family has been touched by COVID. I am therefore compelled to take action, which is why I have signed Executive Order 2020-51, which will take effect on Sunday at 12:01 a.m. The order will require the following of businesses: social distancing of 6 feet or more to the extent possible. The order does not limit indoor restaurant capacity. The order requires facial coverings for employees and visitors or clients at a business. Businesses would be encouraged, where possible, to allow telework or establish a rotation or staggered schedule to reduce on-site employees. Businesses need to display visible signage reminding people to socially distance and wear a mask. Businesses need to use physical markings and/or other measures to help maintain social distancing requirements. Our goal is simple. It is to target the few bad actors. I call them bad actors because these are the ones who act like they care about the personal safety of others, when in fact, they only care about their bottom line. They put profit over people. The businesses who are the good actors and which comply with this order need not worry about the penalties, for they are the ones who put the people over profit. Fines established by the order are set up as such. The penalties for violating this emergency executive order shall include a fine not to exceed $500 for immediate citations issued by code enforcement or law enforcement officers. Or alternatively, a fine not to exceed $1,000 per day for a first violation imposed by a special magistrate and $5,000 per day for a repeat violation imposed by a special magistrate, pursuant to Chapter 11, Orange County Code, and Chapter 162, Florida statutes. However, if a special magistrate finds a violation to be irreparable or irreversible in nature, it may impose a fine not to exceed $15,000 per violation. Our strike teams will continue to do compliance visits to local businesses and take appropriate action. So far, the compliance teams have visited over 5,600 businesses and have achieved an overall compliance rate of 98%. Much like our healthcare workers and first responders, they are on the front line of defense against the spread of the virus. I say thank you to all of those on the front line who continue to work diligently each day, because the battle is not over. And now, to the numbers and the rest of our briefing. We have passed another milestone. There are now over 60,000 positive cases of the coronavirus in Orange County. To be exact, the Department of Health indicates that there are 60,392 cases in Orange County. That is an increase of 620 new cases from Wednesday to Thursday of this week. Our 14-day positivity rate is 6.2%. 651 Orange County residents have died as a result of the coronavirus, which is an increase of 6 residents who died since our briefing on Monday. To those families and victims, please know that our hearts and prayers go out to you during this difficult time. Dr. Pino, our health officer, will have more details about the numbers. We have endeavored all week to make certain that our residents had access to free testing. At Barnett Park, Orange County Health Services continues to offer free testing from 9 a.m. to 5 p.m. each day of the week. We are still offering 2 kinds of testing: a rapid antigen test where results are back within 15 or 20 minutes or so. And they're offering the PCR, or the molecular test, which results typically come back within 48 hours. On Thursday, Yesterday, health services performed 1,600 tests. 1,143 of the tests were antigen tests. For more information about the testing and where you can go in our county, please visit our website at ocfl.net/testing. As a reminder, Barnett Park is open this weekend, tomorrow, Saturday, and Sunday. We have endeavored to make certain that our individuals and families get the crisis assistance they need in our community. Our Orange County Cares Grant program for individuals and families is opening its online application portal again on this coming Tuesday, December the 8th at 8 a.m. The application portal will allow up to 20,000 residents to apply for $1,000 grants. Perhaps this may be the final time the portal will open. The team will assess whether to reopen the portal again after this next round. For those who were denied in the past or had a duplicate application and were denied, you are now eligible to reapply on December the 8th. On our Orange Cares webpage, we have put together a guide for those who have been rejected. Visit again ocfl.net/orangecares to read this article and learn about eligibility and other documents required. This is the final week of our online donations and support for the Mayor's Toy Drive. I want to thank our media partner in this drive, Fox 35, for coming to our warehouse this morning and showing Orange County staff sorting toys and distributing some of those toys to social service agencies. There's some photographs behind me. So far, nearly 3,000 toys have been donated, which is a wonderful number, but the need is even greater. If you're looking for a way to give this holiday season, you can do so online through Monday, or drop off a new unwrapped toy at over 20 drop-off sites across Orange County by December the 14th. To find a site near you, there are multiple ways that you can support this effort. Again, go to our website at ocfl.net/toy drive. I'm also pleased to announce that Orange County Animal Services is preparing to distribute more than 3 tons of free pet food at the South Econ Recreation Center on Wednesday of next week, December the 9th. The pet food giveaway will begin at noon, and it is on a first-come, first-served basis. Events such as these are all part of a concerted effort by Orange County to assist residents who are being financially impacted by the COVID-19 pandemic. We want to keep pet owners and their pets together. In keeping with proper COVID-19 social distancing protocols, this is a drive-through event. Back in June, Orange County Animal Services held a similar event and distributed more than 700 bags of pet food. We are lucky to have 2 generous sponsors for this effort. Don Mealy of the local family of auto dealerships, and Paul Ween, founder of Pulsivity Shelter Photography. For more information on our upcoming drive-through pet food giveaway, you can also visit Orange County Animal Services Facebook page for more information. With that, I'm going to turn it over to Dr. Raul Pino.
Good afternoon, Mayor. Good afternoon, everyone. Thank you for being here. Before I give you some of the data, I would like to emphasize some of the points that the Mayor just made, especially with regard to healthcare workers, as they are getting tired, hungry, stressed, and traumatized for what they are experiencing. There is no training that can prepare you to see and experience what they are experiencing. And not even an Army training will prepare you for this type and number of casualties. And I don't want to be graphic, but also the manner and way that people are dying is quite horrific. So it is important that we do everything we can to support our healthcare workers and help them to help us, because we need them right now more than ever, and they are exhausted. For churchgoers, it is important to help God to help us. It is important for our religious leaders in this new phase that we are entering, when possible and at all cost, to do virtual services, to do open space services, to have enough sanitation and ability to space out in church. Please do not do choirs. If you can, use tape recorders, use music. It has the same effect. Choirs are particularly risky. For school-age children as a parent, we have seen an increase in the number of kids and also the number of people that we have to send into quarantine. And the transmission is not happening at the schools. But every effort that we make at the school will be irrelevant if when the kids go back to home, we don't keep them safe and as much as possible in the family cluster. And when they go outside, which they need to exercise, we should supervise them to avoid them from making mistakes. It is crucially important in this phase that we are entering for bar, clubs, and restaurants to adhere to CDC guidelines. We are entering a critical phase in this pandemic, and you all have seen the news, the national news. Fortunately, our county is in much, much better shape than many other counties around the state and the country. Miami-Dade today have 2,500 cases. Yesterday, almost 2,500 new cases. Those are serious numbers. And if we don't keep what we are doing and increase what we must do, we could be on the same boat. We also have made a great effort to stabilize long-term care facilities and the number of infections in long-term care facilities. And we have been very successful with their help and their effort and the support from the state and the county. That to minimum levels at this point today, we don't have any major significant outbreaks in any long-term care facility in our county. What we do today, because it's light at the end of the tunnel now with the vaccines coming, what we do today is going to determine who gets to the other side alive. It is that serious. The state of California is almost running out of intensive care unit beds. And when you get to a point where you have to rationalize healthcare, that is ugly. It is ugly that someone arrives to a hospital where you expect to be cared for and there is not a bed to offer you the services that you need. With that, the mayor provide you with the general numbers about the pandemic. I just want to clarify 2 points for the public in general. Yesterday, we received 620 new cases. And if I give you the 7 days, you will see that it's going up, and it goes down, and it goes up a little bit, another inch. And it goes down half an inch, but it goes up 2 inches. So it is growing. And fortunately, we have increased the number of testing over 9,000 a day. Of course, we are going to find more cases if we do more testing, but that's the objective of doing testing: identifying people, being able to isolate, being able to quarantine. But when this number gets to this level, the health department is unable to get to every single case. We probably will need 1,000 employees, really, to get to every single person out of those 620 and every single contact that those person generates. In average, any person can generate from 4 to 6 contacts. So it multiplies immediately. To the point that we have decided to start prioritizing who we get to first. Fortunately, our healthcare system continue to be in a very good health. And if we can show we are going to start monitoring the healthcare system, the other graphs, the PowerPoint in green and blue. Perfect, thank you. So this is the hospital-wide census for our county. And if you can see, we have a health inventory of beds. Remember that a bed is not just a bed, it's also the bed and everything else that goes with the bed. The nurse, the lab tech, the x-rays, the ultrasound, everything that goes with that. And this is our census for COVID-19 in ICU beds. In blue, you have the adult ICU beds. In orange, available ICU beds. And in gray, the COVID-19 in ICU. So in blue, the general census. Yesterday, we have 273 people in our county with COVID-19 hospitalized. We have 129 available ICU beds, and we have 34 people in ICU yesterday for COVID-19. Those numbers are quite low compared to what we saw earlier when we had the second wave. And we wanted to keep it this way. The hospital reported today to the mayor and other leaders around the area that this is the case, that the hospital continue to have a healthy inventory of resources. This is for pediatric beds, the same. And of course, children are getting less affected, require less hospitalization than adults in this pandemic. This is how you compare ICU beds versus ICU beds, COVID-19 versus non-COVID-19 cases in ICU bed. And you can see the high proportion of the ICU bed occupancy is not related to COVID-19. Here we have the total ventilators in our county, which yesterday we had 691 and 21 people yesterday on COVID-19, on ventilators because of COVID-19. This is COVID-19 in ICU bed, and you see the decrease from the summer that we experienced high numbers to where we are today over here. But there has been some blips in the data that are indicating that, as I expressed before, it feels like a pressure cooker, like it's building pressure inside the system. And this is non-ICU beds for COVID-19. And there has been a small increase in the last week. And this is the total number of people hospitalized for COVID-19 in any of those categories that we initially described to you. To conclude, what is critically important at this point is for all of us to adhere to CDC guidelines, to be more vigilant than ever, and to protect those who are 65 years and older who has pre-existing conditions. The school system is performing well, and we are able to get to those cases. Our airport has the highest numbers in the country coming in the last few days, so people feel safe to come to Orlando, and we should keep it that way. And the only way that we can keep it that way is if we adhere to CDC guidelines. There is not a contradiction between running the economy and preventing the spread of COVID-19. Thank you.
Okay, we'll go to questions at this time. Just as a reminder, if we have any Spanish-speaking media, if you ask your questions in Spanish, we have a translator here, Ms. Ilia Torres, one of my special assistants, and we're also joined by Orange County Commissioner Maribel Gomez Cordero, who is here, and she's fluent, and of course, Dr. Pino is fluent in Spanish. I also brought back up today, I have the county attorney, Mr. Jeff Newton, here, so if there are legal questions about the executive order, I may go to him. We also have Mr. Scott Howard from the Orange County Public Schools, who is here in the audience. And then we have also Mr. Tim Boldick from our compliance or strike teams that has been monitoring the level of complaints that we are receiving about non-compliance within our community itself. And so with that, we'll open it up for any questions at this time.
Mayor Lauren Seabrook, Channel 9, my question's for you, and this is in regards to the executive order. I'm wondering, you talk about that this is for habitual offenders, for bad actors. We have talked in the past about some of these businesses that have 4 or 5 times failed inspections from the strike teams. Will there be some kind of a formula where if a business fails twice in a row, they will be fined, or is there going to be situations where there's something is so egregious that they're fined on the first time?
Typically, in terms of the direction that we're giving staff, we want to be consistent in how we are applying the enforcement. Obviously, if we have a history with a business where that business has been visited and has been warned on numerous occasions, we're not going to start over and act like that business never had any warnings. But generally speaking, we will visit a business to gain compliance. We want to be proactive to assist our businesses in remaining open. So we will give them instructions on what they can do to comply with the executive order, to comply with those CDC guidelines. We will go back and re-inspect businesses who we initially find to be non-compliant. We have to look at the totality of the circumstances at that time. If the staff believes that the business has attempted to comply, we're not there to be really punitive at that point. We want to gain compliance, voluntary compliance. Likely, if that staff member has to go back for a 3rd time and there's still non-compliance, they will likely be looking at the penalty of not to exceed $500 for that initial fine.
This is for you too, Mr. Mayor. Steve Hudak from the Sentinel. What is your worst fear with the confrontations that may likely result with the teams going in to talk to these non-compliant businesses?
We're going to be focusing during all hours of the day, but primarily where we see the most significant number of violations occurring, it is during the evening hours. It is for the bars and similar types of establishments. So we're going to make that a priority. I do not expect my unarmed staff to go into those businesses to do enforcement without the assistance of law enforcement. So we will be depending on law enforcement in some cases to ensure the safety of everyone involved, including our staff. And then, based upon how the executive order is written, law enforcement has the authority to issue a penalty or give warnings without the presence of a member of our compliance teams.
Mayor Demings, Asher Rama, Channel 13. Question for you and for Dr. Pino. First, I've spoken to a lot of venues today. It's weddings, every weekend now. Venues are kind of confused as to who's responsible if the wedding parties don't want to partake in these social distancing measures, whether it's on the dance floor, dining. And then for Dr. Pino, do you have any insights into why Governor Ron DeSantis is ordering state leaders not to release the state's weekly report from the White House Coronavirus Task Force, and whether county-level Department of Health officials are deciding this information or not?
I've never seen the report, and I don't have any insight on the governor's policymaking.
In terms of the question reference, the wedding-type venues, that primarily is not the focus of what we're trying to do. Those are typically one-and-done types of events. They're not businesses per se. And so our focus is on the legitimate businesses where large gatherings, there's a frequency of patrons coming into the business, retail type establishments. So because if by the time we got a complaint reference a wedding, by the time we could process that and get it into the system, it probably will have a low priority at that time and the wedding will be over. So I think realistically, if we saw one particular type of wedding venue repeatedly in violation of having some issues, then we would certainly try to work with the venue management to gain compliance.
And with regard to the weddings, if I could add, Disney developed together with us a very comprehensive approach to weddings. And they probably have it on the website for the wedding. If anyone wants to have access to, it's quite comprehensive. Not everyone have the resources that Disney has, but we can try to mimic what has done to protect wedding parties.
Kelsey Thord with West 2 News. This question's for Mayor Demings. It might also be for the county attorney as well. I know, there's this back and forth between what you guys at the county level want to be able to do, and then at the state level, the governor has been pretty adamant about not wanting to fine people. So I know the kind of workaround that you guys have here is you're going after businesses and not individuals, which is what the governor's order says. And I saw in here at the end, you have this sentence that says that if it comes into conflict with a state or federal order, then that section of the executive order no longer applies. Are you worried that there could be a lot of pushback from businesses trying to sue, saying that this isn't compatible with the governor's order, or even the governor himself may be coming back and re-editing his own executive order to include businesses?
I wouldn't say I'm worried about whether we can enforce the executive order or not. No, my worries have more to do with the spread of the virus and more people getting infected. That could have catastrophic results for our families and the residents of Orange County, and that's what we're trying to do. We're trying to be proactive here, and while some businesses may perceive that this is punitive, and we're trying to close businesses down, it's really the converse of that. What we're trying to do is ensure that we are able to safely keep our businesses open. And that means compliance with what the researchers have clearly established as the best strategy going forward. We know that we're months away from the general public being able to be vaccinated against the virus. That's going to take months before there is the majority of Americans or Floridians or Orange County residents who are going to have access to a vaccine. So that means that during the interim, we have to learn to live with the virus. And so we have to, in terms of our strategy, try to control the spread of the virus so that we do not overwhelm our hospital systems like Dr. Pino alluded to. He also shared with you that for the last few days, the Orlando International Airport has been, in terms of air passenger travel, the #2 airport in the country. but for the 5 days, I think, immediately prior to that, they were number one. What that means is that people feel comfortable traveling here, and that's good for our economy, but it also creates additional exposure. When people are coming in, they bring with them whatever types of exposures that they have seen in their respective areas. And so that means that it is essentially a lot more important for us to do what we're doing here now, to be proactive, to make certain that our businesses, our front line of defense is in order. So while some may think it's in conflict with what the governor is doing, I don't know. I can't speak for the governor and what motivates him. I'm more motivated about keeping our residents safe. The county attorney has looked at this from a legal perspective and made a decision that if there is litigation or some type of action taken within the courts, that we are able to remain with something that is enforceable. So it was preemptive in a way to keep us out of a particular quagmire if that should develop. But I'm not worried about any particular conflict between what I'm trying to do here on behalf of our residents and what the governor is doing.
Paul Rivera, Channel 2. Mayor, transparency check here. Will the public be notified what businesses are getting fined, how much, and how will they find out?
Absolutely. You know, when our compliance teams have visited businesses, we post a list of those who have been determined to be non-compliant. I think in the spirit of public health and public safety, we want our residents to be as informed as we possibly can be during that process. So our various websites have been sharing information over time to make certain that our community is well informed.
Una pregunta en español, por favor, para el alcalde. Quisiera saber un poco más. Ya mencionó que la mayoría de los problemas se están dando en los sitios nocturnos, en bares y nightclubs. ¿Cómo se va a atender a esta situación? Hemos visto muchos videos en redes sociales con conciertos, con multitudes, cero distancia. ¿Cómo va a entonces atender esta situación donde hay tantos negocios que semana tras semana no cumplen con las normas?
So the question, he would like more details as to how are we going to handle the problems with the bars and nightclubs that are occurring on a weekly basis, where we have witnesses, no social distance, not wearing masks, etc.
We will certainly continue to respond to any complaints that we receive.
Continuaremos en responder a cualquier queja que recibamos.
However, we have a responsibility to have firsthand knowledge about specific activities occurring. When I say we, I'm talking about the code enforcement officers or the law enforcement officers. They need to be able to observe it or identify someone who can sign and swear that this is what I've observed.
Continuaremos en responder a las quejas que recibimos de parte de nuestros residentes, pero también tenemos una responsabilidad de tener conocimiento de primera mano por parte de nuestros oficiales de cumplimiento de ordenanzas y de cumplimientos de orden público, de personarse al lugar y ver que estas acciones se están dando.
In order to levy fines going through our quasi-judicial or processes that we have in place, we have to have the evidence to support it.
Poner multas en este proceso cuasi judicial que estaremos siguiendo, necesitaremos ciertamente tener evidencia de las violaciones.
So if we receive a complaint, it may require us to go to that physical location and observe the activity.
Si recibimos una queja, o va a requerir de parte de nuestro personal de personal a ese lugar y observar la violación directamente.
We are depending upon members of the public to provide us the information.
Dependemos de nuestro público y de nuestros residentes de que se nos provea la información.
Hello, Mayor. Pete Reinmold, digital reporter, Spectrum News 13. Could you elaborate on your degree of confidence that the penalties in your executive emergency order would stand up against a legal challenge, and cite which Florida statutes that you saw that would give you such confidence?
I have one of the best county attorneys anywhere. He's well experienced. He's been the county attorney here for a number of years. He's been the county attorney in Broward County, and his team of lawyers have researched this. So I'm confident that they are competent to be able to provide the advice necessary for me to proceed with this executive order. But I'll ask him if he wants to come up if I missed something, in this. The county attorney, Mr. Jeff Newton.
Mayor, I could not have given a more eloquent response to that question than you have, but there is certainly provisions in Florida law, Florida state statute, chapter 252, which considers an executive order to have the full force and effect of law. And so what that means is this executive order can be enforced as if it is a county code provision, a county ordinance. And so I have no concerns whatsoever about the legal authority which this executive order is based on.
And we remain under a state of emergency, much like America remains under a state of emergency. The state of Florida is still under a state of emergency, which is how and why the governor can issue executive orders. And because we're under a state of emergency, under the county charter, as the county-wide elected mayor, I become the emergency manager for the entire county, inclusive of the cities, which gives me certain authorities when we're under a state of emergency. And by the way, this executive order is effective, will be effective, inclusive of the cities, the municipalities, and the unincorporated areas of Orange County.
Nikki Zizazo with News 6. This question is for Mayor Demings. Mayor, for weeks during these press conferences, you have expressed reluctance to make this move, saying you're hoping it wasn't going to come to that. At the same time, some of these businesses, are repeat violators. So what was the last straw for you to make this move after weeks of saying you were hoping it wouldn't come to this?
Well, there were a number of instances which contributed to my final decision. First, I would not have put the executive order in place if we did not continue to see the spread of the virus, and cumulatively the number of new cases increasing, the number of positive new cases going up. So that contributed to my decision. The other is that it was obvious that when we visited a few businesses 5 or 6 times, that they did not intend to become compliant. So we have to hold everyone accountable during this process. And so that's was one of the things. Obviously, within the recent past, when our compliance management team informed me about the number of times that they went to a few of the businesses, it was concerning to me. So collectively, those are the things that we decided to put into place. We are going into a critical period of time, as I started out by saying, because we're approaching one of the busiest holiday seasons of the year. We do not yet fully understand the impact of the Thanksgiving holiday period on the spread of the virus. And I think we're, quite frankly, during the winter months, I think it kind of aggravates the conditions by which the virus can spread. I have competent advisors such as Dr. Pino. His team of people have worked with our staff here, the medical doctors and team that we have internal to Orange County government. And they all have said to me that we are on the cusp of danger going forward. I don't want to find ourselves in a situation where we are exceeding hospital capacity when we could have taken action early to preclude that from happening. So I think timing is everything, and so for me, the timing of issuing this executive order is important. It's at the right time before we see those numbers that Dr. Pino showed, where they are surging beyond the previous surges that we saw here within our community.
Mr. Mayor, Kiara Shanti for Jericho Broadcast Networks. Question for you, and with respect to your lawyer. The CDC guidelines are just that, guidelines. They're not laws, so people don't have any real obligation to follow them. In addition, Florida statute and the Florida County Charter actually doesn't give you authority to make a mandate on masks. So how do you justify fining businesses for requiring customers to do something they don't actually have a legal responsibility to do?
Let me ask you a question. Are you an attorney?
I can read the statute as well as any attorney.
That's not what I asked you.
It's plain written in English.
I'm trying to establish the basis by which you are making your assertion. If you're an attorney and you've studied this and you're a bar certified attorney, then maybe you're qualified to make that statement. Are you a physician? Are you a researcher?
It's easy. It's called Google. I mean, not to be rude.
Okay, that answer is Google's the answer. Okay, so what I would tell you is that we have competent authority that has gotten us to this point, and I'm going to listen to the competent authority. And Dr. Pino, perhaps you want to respond to him.
I don't know about the gentleman, but I will advise the public not to trust Google for their health.
So we can go to the next person.
So the question is, again, how do you expect businesses to be penalized for something that customers don't have to do?
Okay, sir, we've already explained. The county attorney has given you the law. I think he is qualified to say what he said. I think Dr. Pino is qualified. You have not established that you're qualified to make the judgment that you've made. So we'll move to the next question.
Yes, this next one comes in from Troy Campbell from WKMG for Dr. Pino. Dr. Pino, how many doses of the COVID-19 vaccine are you expecting Orange County to receive, and when do you expect the first shipment to arrive? Also, when do you expect a healthy resident in Orlando under the age of 40 who doesn't qualify for any of the possible priority groups to receive a vaccine?
A lot of questions in one question, so let me see if I remember. So everything that I'm going to say is just very preliminary and could change tomorrow. So with that caveat first, I believe that we are supposed to receive approximately 170,000 vaccines, dosage, that is, for in the first shipment. That will depend, of course, of how many the state gets. Now, to give people an idea, the state has established 5 hospital centers around the state where those vaccines, first shipment, will go to it. And the hospitals have, at this time, establishing a priority list within the entire, within their systems, who in the system is going to get it first. I don't think that the public at large should expect to be vaccinated before February. Our planning is preparing for February to have the ability to do pods, open pods, to the public. We will continue to explain as we progress, but I really don't like to give preliminary information because then it changes all the time. Now, all that, what I'm talking about is the first shipment of the Pfizer vaccine. There are other vaccines coming on, and as they get approved, we will get more. The issue with the Pfizer vaccine and why it's going straight to the hospital is because it requires a very low temperature, and those facilities have the ability to have that temperature. And for obvious reasons, healthcare workers will go first. We have to stabilize the workforce that is taking care of all of us. And within healthcare workers, I assume in hospital, we prioritize emergency rooms, ICU, and the people that are in most contact with the general public.
Thank you, Dr. Pino. This one is also for you from Naseem Miller with the Orlando Sentinel. Dr. Pino, can you please talk a little bit more about the prioritizing of contact tracing you mentioned, and what's the change from before?
So the change from before is that we are having too many cases for our ability to reach everyone on the same day. And also the large number of students that we have to send into quarantine and the whole lettering and calling each of those students and their families has added to this volume. So the way that we prioritize is the same way that we are prioritizing the vaccine. We go to those who have the most ability to impact the larger public. So healthcare workers, of course, any outbreaks in healthcare facilities, especially long-term care facilities because of the high mortality. And then we also try to assess people who are over 65 years old and may have pre-existing conditions. We also are finding that, as I mentioned in the school children population, is developing in clusters, family clusters. But I think that is going to help us the fact that the Centers for Higher Education are on extended break until January. So that's going to help the county. But it also means that those students have displaced to the place where they live. So although we may not have the large volume that Orange County has of these type of students, they are somewhere, and somewhere is going to have an impact. So with regard to long-term care facilities and how we are prioritizing, it's also important for anyone that has a family member in a long-term care facility to ask the facility if they have registered with the state of Florida for the vaccine. We have 159 facilities that qualify in our county, and we have 5 facilities that have not registered. Our employees today, we're going to visit those facilities in person to see why they have not registered, and they have the ability to register those facilities right there in place. But it's critically important that they are registered so that we can provide the vaccination when it comes.
Thank you. This next question comes in from Leslie Postal for either Dr. Pino or Scott Howitt with OCPS. Her question reads, OCPS posted record number of cases Monday and Wednesday. Is this fallout from Thanksgiving? Any additional things schools, are there any additional things schools are doing at this point?
Well, I will leave the additional part of the schools to Scott. The numbers are just the reality. We also increased by 15,000 the number of students that we're having. Is that the correct number, Scott? 15,000 new students came into, into face-to-face. So that increased the volume of people in the schools and increased the volume of people trafficking back and forth from the community to the schools. And as we said before, anything that the school or us do during, 8 to 3 or 2 when the children are, will go to the west side. If they won't go home, they are just let go to behave in any way that is not supervised. These are children, so we have to help them.
I think the dashboard does show increases for this week, and I think Dr. Pino warns us too at looking at 2-week averages. If you look at the week prior, the numbers were extremely low. They were reporting them, but they weren't being put in as confirmed. Once they were confirmed as they came back, being delayed because of the holiday week, they've been put in over the first 3 days. They're high. I mean, they're significantly high. I think we added 45 yesterday, and we were close to 60 the day before. But if you look at the average over those 2 weeks, it averages out to about what it was going into the holiday week. So we're really just catching up to those cases that were reported upon returning or reported over the break. And we did have an avenue. We're going to continue to use that same notification process when we enter winter break. And we'll gather the data, and then we'll share with Dr. Pino's staff to make sure that contact tracing and other things are being done. But we want to make sure that we're still tracking and getting those confirmed cases, and they're continuing to go in and will, and it'll continue to update over this week.
Thank you. And these last couple questions are for you, Mayor Demmings. The first one is from Melissa Thomas with Florida National News. Mayor Demmings, your draft executive order requires businesses to place plexiglass or other barriers between employees and patrons. What if a smaller business can't afford to install the barriers? Is there an alternative option, financial assistance to help with them comply, or will they simply be fined?
We have provided small business crisis assistance dollars. They certainly could apply for those dollars, and depending upon the circumstances, if they're in business, we have worked with a number of vendors, and the installation of plexiglass and those types of things really isn't that significant. So we still expect the business to do what they need to do to be in business to keep their employees and their patrons safe.
This one is from the Orlando Sentinel. Mayor Demmings, what, if any, communication have you had with the governor or governor's office, his staff, regarding this executive order?
I have not had any communication with the governor's office regarding this executive order. I really don't feel like I have to go to the governor to ask permission to be the mayor of Orange County.
And lastly, Mayor, this one is from Mike DeForest from WKMG. Can you please, this is non-COVID, he goes, can you please share your reasons for selecting Commissioner Siplin to sit on the Expressway Authority Board and your response to citizens who are concerned about her prior support for the road through Split Oak?
That has nothing to do with this press conference, and I'll be glad to respond to that offline. Are there any other questions? Okay, let me just say thank you to all of you for your patience this afternoon. Press conference ran a little longer than normal, but we had a lot of information to cover. We are working diligently to try to keep our citizens safe and provide all of the resources that they need to be successful in our community. So again, thank you. Have a great weekend, and we'll talk to you all on Monday.